Gastro-oesophageal reflux disease is a very common condition. In the UK, more than 12% of the patients can experience acid reflux on a weekly basis. More than 5% of the patient may even experience this on a daily basis. In gastroesophageal reflux disease, patients experience a reflux of acid from stomach back into the esophagus. Generally, the symptoms which are experienced by the patients are in the form of heartburn, which is burning sensation behind the sternum or the breastbone. Some patients may even experience sour taste in the mouth or excessive salivation. There are different other symptoms which patients with severe gastroesophageal reflux can experience. These may include hoarseness of voice, bad breath, nausea or feeling sickness, painful swallowing. A number of times patients may even experience frequent dental erosions or worsening of breathing conditions such as COPDs or recurrent chest infections. There are a number of factors which contribute to gastroesophageal reflux disease. The commonest conditions which can trigger the reflux symptoms are related to the food that we eat. Certain foods such as acidic food, tomatoes, excessive coffee or chocolate drinking, fatty food, spicy food, carbonated drinks can trigger gastroesophageal reflux. The reflux symptoms are often seen in patients who are overweight or obese, who are smokers, who drink alcohol in excess. Stress is also one of the commonest conditions which can precipitate gastroesophageal reflux. The reflux disease is often also seen during pregnancies or the patients taking anti-inflammatory medications on the long term. There is another condition called hiatus hernia, where there is a weakness in the diaphragmatic muscle through which the esophagus or gullet continues down as a stomach. So when there is this weakness in the muscle, part of the stomach can herniate back into the chest, and that weakens the valve which is present at the junction of esophagus and the stomach, and that can lead to reflux. There are different ways of treating gastroesophageal reflux disease. The commonest one is lifestyle modification, whereby avoiding the diet that can trigger the gastroesophageal reflux symptoms. Also, smoking cessation, cutting down on drinking alcohol, weight reduction, and avoiding stress or minimizing stress, particularly by mindfulness and relaxation. All these factors do help in reducing the gastroesophageal reflux symptoms. There are a number of on-the-counter medications which can be taken to minimize the reflux symptoms. These are antacids, Rennies, Gaviscons. There are certain group of medications called H2 receptor antagonists. Of course, the ranitidine is not available anymore. However, the commonly used medications are called proton pump inhibitors, which include omeprazole or lansoprazole. These are the medications which are generally used to treat the gastroesophageal reflux symptoms. Also, there is a group of bacteria, we call them Helicobacter pylori, which can sometimes be present in the lining of the stomach. And these can increase the amount of acid that your body produces. Eradication of the Helicobacter pylori can reduce the intensity of the symptoms in large number of patients. And this includes a week's course of antibiotics. So your doctor will usually test you for Helicobacter, and if they are positive, the patients are treated with Helicobacter pylori eradication. The surgical treatment for gastroesophageal reflux is considered when the medical options fail, or if the patients do not want to take medications for long term, or if the patients are intolerant to the medications. Now, the surgical treatment is generally called a laparoscopic fundoplication, which is a keyhole operation to try and tighten the gap in the diaphragm through which the hiatus hernia takes place. This procedure is carried out under general anesthetic. The surgeon generally makes 4 to 5 tiny cuts in the top part of the tummy. And looking through the camera, the gastro-esophageal junction is dissected. The displaced part of the stomach is brought down into the stomach. And then stitches are taken to tighten the gap in your diaphragm. After doing this, the top part of the stomach, we call it fundus, is wrapped around the lower part of the esophagus to create like a valve to stop the acid from going back into the esophagus. Now, there are different types of these fundoplications, which may include a full wrap, which is called Nissen's 360-degree fundoplication, or partial wrap, which include 270-degree two-phase fundoplication or anterior dors fundoplication. Whichever types of surgery is used, the outcome is generally excellent. More than 95% of the patients, the surgery is successful and they may not need to take acid medications literally from the day of operation. In terms of risks and complications, like any other operation, there are small risks which the patients are made aware of. This may include risk of bleeding, infection, or injury to the esophagus or stomach. Most patients after the anti-reflux surgery do experience difficulty in swallowing, which can last for a few days to for a few weeks. Hence, a special diet sheet is provided to the patients, and the patients are gradually built up on a sloppy diet from liquid diet or to soft diet, and then full diet over a period of 6 to 8 weeks. Small number of patients may experience difficulty in swallowing, which may last even longer than that. Certain food types, such as bread, chunky meat, rice, pasta, the patients may find these difficult in the initial few days after the surgery, and the advice is provided accordingly. But overall, the success rate after laparoscopic anti-reflux surgeries are quite good. And there are other methods of treating the same condition surgically, which is now developing in the country, which does include placing a magnetic band around the junction between the gullet and stomach to try and improve the gastroesophageal reflux symptoms. We often advise the patient to consider lifestyle modification when the gastroesophageal reflux symptoms are quite severe. This may include having 4 to 5 smaller meals throughout the day rather than having heavy meals. We also recommend having an evening meal 2 or 3 hours prior to going off to bed, because most of these symptoms are generally felt when the patients are lying in bed, when the gravity is eliminated. We also recommend that the patients may raise the head end of the bed by 15 to 20 centimeters to eliminate the influence of gravity. Dietary modifications in the form of avoiding food that trigger the gastroesophageal reflux symptoms, avoiding or cutting down on alcohol, and stopping smoking. Of course, losing weight helps in majority of the patients, and cutting down or reducing the stress by relaxation techniques and mindfulness does help in controlling the reflux symptoms. If the gastroesophageal reflux is untreated, then there are certain complications which some patients may experience. The first complication is called esophagitis, when there is inflammation of the lining of the gullet, and the patients may experience severe pain with meals or vomiting of blood or difficulty in swallowing. On the long term, they may develop into what we call it as stricture, which is a narrowing in the part of the gullet. And these patients may need endoscopy, which is a camera, and stretching or balloon dilatation of the strictures. If untreated, sometimes the patients may develop what is called as Barrett's esophagus. This is a condition where the lining of the gullet changes from the simple squamous epithelium into columnar epithelium. 1 in 10 patients will develop Barrett's esophagus over a period of many years, and 1 in 10 to 20 patients with Barrett's may end up developing esophageal cancer over 10 to 20 years. Hence, patients, once they develop Barrett's esophagus, are advised regular surveillance endoscopic tests, which are generally performed once every 2 yearly. And the biopsies are taken from the lining of this Barrett's to confirm that the lining epithelium hasn't changed and hasn't become precancerous.